Hello everyone, I am Dr. Kavyashree, consultant gynecologist working at Koshys Multi-Speciality Hospital. Today we are going to talk about cervical cancer. January month we are celebrated as a cervical cancer awareness month. In India, it is the most common gynec cancer we can see in the women, and almost 1.5 lakh women are diagnosing every year with the cervical cancer. So hence we have to spread awareness as much as possible. So what is cervical cancer? It is a cancer arising from the lower part of the uterus. Here you can see this is the lower portion of the cervix, lower portion of the uterus. This we call it as a cervix. The cancer arising from this portion we call it as a cervical cancer. It's also called as a mouth of the uterus. Who are all at risk for this cervical cancer? All women are at risk for cervical cancer, especially those women are having sexual intercourse with a multiple sexual partner, sexual promiscuity, and those who begin the first sexual intercourse before the age of 90, women given multiple childbirths, those women smoking history, family history of cancer, and women with low socioeconomic status. These are the conditions we can see most commonly the cervical cancer. In almost 80 to 90% cases of cervical cancer, it is arising from the human papillomavirus. It is a sexually transmitted infection. Warning signs and symptoms of cervical cancers are: one is the bleeding disorders like heavy and longer menstrual period bleeding in between the cycle, and bleeding after having sexual intercourse. These are all the abnormal menstrual pattern. In these cases, you have to go and consult a gynecologist. Then other symptoms are pelvic pain, low backache, loss of appetite, loss of weight, and sometimes maybe asymptomatic also. And few women they'll have abnormal vaginal discharge. It may be very foul smelling. These type of symptoms if you have, just go and consult your gynecologist without having any fear or anything. Cervical cancer can be prevented by early screening and vaccination. Early screening done by many methods are there. One is by pap smear. There are many guidelines are available to do this pap smear. Pap smear is nothing but we will take a smear from the cervix and will examine under microscope. Cervix sheds the cells, so these cells we will examine under the microscope. Depending on the morphology, we can diagnose the cervical cancer. So cervical cancer screened. Why? Because it has got a long latent period. From the time of infection and the disease manifestation, it will take long period, almost 10 to 15 years it will take. So hence we can screen early and we can treat it early. So because it has got a precancerous lesions will be there. So in that we can diagnose in the early stage and we can treat it. Pap smear can be done from the age of 21 years. Those who are sexually active women between 21 to 29 years, and once in every 3 years we will do the pap smear. If it comes as a normal, every 3 years you have to repeat it. If it comes anything abnormal or positive, then further investigation done by colposcopy, HPV DNA test, and cervical biopsy can be done. So those women aged between 30 to 65 will screen every third yearly the same pap smear, or if they can go ahead with the co-testing is also available. That is pap smear along with the HPV DNA test. If it comes as a negative, they can be screened once in every 5 years. Otherwise, they don't have the facility to do the HPV DNA, then they can do regular pap smear like every 3 year once. After the age of 65, it is not recommended by few guidelines. Only those women are high risk of CIN 2, 3, those having precancerous lesion, those women can be screened further for another 20 years. As cervical cancer is mainly caused by HPV viral infection, HPV vaccination is available. It is a highly efficacious vaccine. It prevents the cervical cancer by 80 to 90%. So at what age we can give the HPV vaccine is from the age of 9 year to 26 year. All girls can take the vaccination, especially before they exposed to the sexual intercourse, they have to take the vaccine. After exposing to the sexual intercourse, it is not that efficacious. So from the age of 9 to 26 year, all girls can be advised to take the cervical HPV vaccine. This vaccine before the age of 15, 2 doses are recommended, one at 0 month and the second dose between 6 to 12 months interval. If suppose the age of the girl is crossed 15 years, then 3 doses are recommended by one dose at 0 month, then the second dose at 1 month, then the third dose is after 6 months. There are many HPV virus strains are there. So according to that, there are two vaccines are available, like bivalent vaccine and quadrivalent are there. Bivalent covers the HPV viral strain of 16 and 18. Quadrivalent it covers 11, 16 and 18. So even after taking vaccination also, women can get cervical cancer. It is not like that after taking vaccination I will not get the cancer, cervical cancer. So and after taking vaccination also, you have to be done routine screening as like other women, those who have not taken the vaccine, like that only same the pap smear screening protocol. You have to continue the same guidelines. And sometimes the boys also can take the HPV vaccine because it prevents the female anogenital and other hidden neck cancers. It can prevent. Let's prevent cervical cancer by regular screening with pap smear, reducing the risk factors, and healthy diet, stop smoking, and with vaccination. Thank you.